Hey guys, welcome back to Medical Coding with Blue. Today is Christmas in July, day 2. Now today's story is going to be all about my very first day as a medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. So this Christmas in July season, I am going to be sharing stories about my past, about my professional past, and about me, because I think this is one of the more unique things I can give you guys for Christmas in July. So I hope you enjoy the stories. So anyway, my very first day, or what I can remember of my first day as a medical coder. If you've been with my channel for a while, or if you're brand new, I started my journey in medical coding through a temporary agency, and they had set me up on an assignment to work at the Cancer Therapy Research Center. Now, this assignment was only going to be for 3 months, and they said that at the end of the 3 months, they were only going to pick one person. So this assignment was for 3 people, but of the 3, you can only pick one. And so whoever they chose was who they picked, and the other 2 just had to go find another job. Needless to say, I didn't get the job permanently, but that's okay because it worked out in a better way. And I will get into that on another video as well. But for the time being, this job, when I started there, we all started at the same day because we were all from the same temporary agency. I had just never met these ladies before that day. And when I did meet them, you know, they were very nice ladies. And they housed us in an office that had big desks, like a big table. It wasn't even a desk officially. There was like 3 long tables. So we each had a table to ourselves, and they gave us books to use. So they gave us the manuals, the ICD-9 manual, because we were not an ICD-10 at that time. You have to remember, I have been coding since 2008. So we had the ICD-9 manual, we had the CPT manual, and of course we had a medical dictionary. So if we needed to look anything up. And they were giving us paper charts to code from because we were basically in charge of taking care of their backlog, because they had a lot of backlog that these encounters still needed to be put to bed. So we were the ones that were coding them. So we had a chart for the patient, and then we had this sheet that we needed to add in all of the diagnosis codes and all of the procedure codes. Anything that needed to be picked up went on this sheet, and it went into the chart, and then we would write it out, and then we would put the chart into a basket that was completed, and then it would go to the team, and they would audit to make sure everything was okay, and then they would do their thing on their end with a computer. But we didn't have access to computers at all. So I was still used to using the book anyway, because I had just gotten my certification 2 months prior. So I was used to working with the book. We didn't have none of us had exposure to an encoder at the time. And so that was something new for me when I went to my second job, but of course I will do that on another video. But this first job, they told us that we had 2 breaks, and we were working 8-hour days. And I think we started our day at 7 o'clock, if I remember right. It was either 7 o'clock or 7:30, but I believe it was 7 o'clock. And we worked all the way till like 3:30 because we had like 30-minute lunch. And so I remember packing my lunch most of those days because there was really nothing but there was like a little convenience store that was in the Cancer Therapy Research Center, but there wasn't like a whole lot there. It was like maybe cold sandwiches and things like that. So I would eat that occasionally, but for the most part I had brought my lunch so that I could be right back there. I didn't go anywhere. I would eat at my table and I would talk with the ladies, and we would all talk, and when we were on break, because we would all take break together. And so we got to be like a little group, because we were all in the same boat. And it was nice. Those ladies were very supportive, and we were all always looking out for each other. And if we had questions, we would ask each other. So there wasn't a lot of that, I don't want to ask because I don't want to be embarrassed. We always asked questions, and so that was really good about our group. And so we did a lot of that. Looking up codes and things like that. We would bounce ideas off of each other. And having that experience as a brand new coder, and being around such supportive people was really good. The supervisor, the lady supervisor, wasn't so nice. She was okay, but she wasn't very nice. She wasn't a very nice person. But we did have a male supervisor, and he was super nice. Like, he always took care of us. He would come up and he would bring us more records to code, and then he would explain things to us, because as we were coding and as we were turning them in, he would audit them as well, and he would look at what we were missing, or if we were doing levels, he would explain to us, like, how do we get to this level, so that way it was a more appropriate code would be selected, because we were still learning, and he knew we were still learning. So that was one of the nice things about being there. So not getting picked was not a big deal, but it was still like, okay, it was a learning experience. And so for being there for those 3 months, it was nice. We had a big window in our office area, so it was nice to be able to have like sunlight coming in as we're working. But I did remember having headphones. I took headphones with me after a while, because you need to concentrate. So it does help when you are doing that, when you have headphones, and you can concentrate when you're in a room full of people. And even though it was just us two that were in there. And so some of the other staff didn't want to get too used to us, because they knew we were going to be there long. That at least two of us weren't going to be there long after 3 months. So we just went through and did that. What else? I remember, getting familiar with a lot of the codes, and starting to like write a list of the ones that were more commonly used at the time. So I would write down like more common chronic illnesses. I would write down those that did need like some specificity, but for the most part I knew what the range was. And if I was going to select a code that it needed to be more specific, I would at least put the range, so that at least that way I know where to flip to in the book. So I would do that, and that helped me. And one of the other ladies saw me do that, so she did it too for herself. And so she took notes from what I did, and then she added some of her own. And she had some that were like, some of the other long-term use codes is what I had on mine. She had more on hers. That I noticed. I was like, oh, okay, well, let me let me get some of these. So she got some of my codes, I got some of her codes, and it worked out, So it was all about learning, and we had our stutter steps. We all knew that we weren't going to get everything right, and that was one of those things. But we were also happy just to be working, and we were like, wow, did you ever think that we would get to this? We would ask each other this question. And we all said no, because looking for a job was really hard, and we were just so glad, because then we knew we could go anywhere after that, once we started getting more experience. So, spending that 3 months with those ladies, it was a good learning experience. And that's pretty much all that was. We just did basic coding. We did coding, we did E&M levels, we did some procedures. We didn't do surgeries, we just did some procedures. And of course we did chemotherapy coding as well. We did some filing of the records when they were put to bed, like with whatever they did with them in the system, in the electronic health record that they were working with. They would put it in there, and then we would take those records and put them actually on a shelf and get them put to bed. So that way they were all organized. But the facility was really nice. It was just a standalone facility, and there wasn't like a whole lot around. But it was in like the medical center, so it was good because you knew right where to go. But it was just this freestanding facility. So, but it was, like I said, it was a good experience. I would have wished for like another supervisor, obviously, with that lady. But the guy, like I said, he was a nice substitute for her when she was not there. So it was always a fun time when she wasn't there. But of course, you always want to remain professional, and that's what I did. And that was my first experience as a medical coder. And I grew a lot from that time, just learning and taking the time to really understand neoplasm coding was a huge deal because I didn't know a lot of things. There was a lot of things that I learned on the job, like that a cancer could be from one place and it could go to another, and I didn't know that. And so I was just like, wow. And so having that eye-opening experience and getting that explanation was like, wow, okay, this makes sense. So, you know, but that is my experience on my first job. So I hope you've enjoyed this story. I'm trying to remember more of the things that happened, but that's all I can remember right now. I remember more of my second job, which I'll do in another video. And that one will probably be more interesting. But anyway, I'm going to wrap this one up. Thank you guys for joining me for Christmas in July, day 2. And I will see y'all on the next episode. Bye.